our amazing speaker. What I'd like to do is acknowledge the indigenous land and culture of New York. And that is, we honor the land as the creator intended, in that we commit to keep it clean and support efforts to make it safe for all. We can show honor to the native keepers of the land by recognizing the value of their culture, by learning the truth of their history and how it shaped this great country. So thank you for that. And as we continue to move forward, we have with us one of our very special guest speakers who will be part of this 3-part series, Dr. Dana Crawford. She will be talking about, in this 3-part series, is titled The Impact of George Floyd and Breonna Taylor on Diversity, Equity, and Inclusion Work, Change, Stagnation, and Next Steps. In this 3-part session, Dr. Crawford will share lessons learned from conducting over 225 hours of trainings and workshops over the last 18 months. Today, she will share ways she has adjusted her work to respond to the anti-racism movement. For part 2, Dr. Crawford and Dr. Wycoff will discuss how diversity, equity, and inclusion and belonging has stagnated along with the barriers to anti-bias work for white people, as well as members of the Black, Indigenous, people of color community. And finally, in the conclusion session, Dr. Crawford will provide concrete recommendations for anti-bias work that shifts from emotional-driven to value-driven, strategic, sustainable action. I just want you to know that even if we are encouraging you to participate in all 3, but if something comes up and you're unable to make one of them, please come to the ones that you can, because this is so powerful. And if you've heard Dr. Crawford before, she can tie it all together. So let's talk a little bit, for those of you who have not had the privilege of hearing Dr. Dana Crawford. She is a pediatric and a clinical psychologist. She's also the developer of the Crawford Bias Reduction Theory and Training, CBRT. This is a systemic approach to reducing bias, prejudice, and racism. She has a thriving practice in Manhattan, New York. She has certifications in medical hypnosis and biofeedback. Dr. Crawford is a graduate of Howard, Temple, and Miami universities, and have degrees in the areas of counseling, African American studies, psychology, and the arts. She also has certification in practical nursing. You wonder, how old is this person? How could she have accomplished all of this? Finally, she completed her pediatric psychology residency at Tulane University School of Medicine, a 2-year clinical fellowship with the United States Department of Defense, and a 2-year fellowship with the Center for Early Connections at Tulane University. In recent years, she has worked with the National Black Caucus to create legislation for Black maternal health equity, appeared on a plethora of news platforms, conducted over 100 trainings and presentations nationally in private, public, and government sectors. Please, I now yield the floor to Dr. Dana Crawford. Enjoy.
Thank you so much, Fanny and Elijah. It is always an absolute gift and a pleasure to just be in your space. And Elijah, I love how you started everybody up. Like, I feel kind of hyped. Like, well, I feel like I need some hip hop theme music to come down. If we were all in person, maybe you all would hype me up and we would I would go to the lectern. But we are virtual. And so I hope wherever you are safe, you are feeling connected, and that you are able to be present with us here today. And so, today I'm going to be sharing just some lessons learned in this work that I've been doing for many moons. But when COVID happened, it really challenged me to think about how do I make my work more accessible? I was really anti this work being virtual before COVID. I thought people needed to sit in the same room, smell the same air, be in the same space to be able to really authentically engage. And COVID was like, ha, 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 that's not going to happen. And it really challenged me to think about, how do you do this work virtually? And so over the last 18 months, I've given about 225 trainings, which equals well over 1,000 hours of work. And when I started on this journey, I sometimes feel bad for folks who were in the early days of 18 months of COVID and trying to do this work virtually, because those were some of my best teachers, because I got it wrong. And I had to learn, what do people need to be able to engage in this work authentically, and then also get back to work in their lives? You know, there are so many beautiful anti-racist, anti-bias trainings in the world, but then you got to go up in the mountains, sort of like a retreat. The work is so heavy and thick. It's like, I can't even function for the rest of the week, let alone the rest of the day. So how do we do this work in a sustainable way, strategically, in a continuous way? And so over the last 18 months, I've redesigned my model, which used to be like an 8-hour full day for continuing education credits, to moving it to more of bite-sized pieces and more of a meal that we can engage. So I'm going to be sharing a handful of lessons learned in this process. Throughout this work, I will be using QR codes. That's one of the things that I learned through doing this in COVID. And the reason I use QR codes is, one, because I just think they're really cool. And it's that black and white box in the bottom of the screen. But another reason that I use it is for accessibility. If you have your phone near you right now, open up the camera feature, depending on how old your phone is. Open up the camera feature, point it at that black and white box, and you'll get a website. And so throughout this training, I'll share some videos, I'll have some images, I'll have some references. Use that QR code to empower yourself to have access to the information right away. So you don't have to later, like, are we going to get the slides? Are we not? I was wondering about that one reference. It's right here. Use the QR code. The other reason that I use QR codes is, although academic and scientific knowledge is extremely valuable, we also have to recognize that there's privilege in even accessing that information. One, in terms of accessing certain journals, who gets funding for what type of research, what questions are allowed to be asked, and what voices are really heard in this work. And so I use QR codes to amplify the voices of the community that are really some of our greatest teachers, but don't often get access to the academic classroom. And so the QR code is to amplify that. So this is a 3-part series. Fanny so generously went over what the 3 parts are. So I'm going to reclaim my time and get onto some other slides, and start off with lesson 1. The first thing that I learned in doing this work is that people are tired. Something happened in deciding to be in a virtual space and doing Teams and doing Zoom and GoToMeetings, and I don't even know what happened with Skype. Talk about a missed opportunity. However, something happened in this pandemic where people decided that since no one had to drive anywhere or get on trains and buses to get places, you could schedule people down to the minute. So you have a 9 o'clock, a 10 o'clock, 11 o'clock with no break time in between. You barely even have time for a bio break. And so I realized in this work, because it's so heavy and because people are so overscheduled, people are so time impoverished. It's something about working in my home. I don't work at home, I work in my home. It's something about that sometimes makes it hard to create the boundaries of time, because you're already, why not do the work? You're on your couch. Why can't you open up the laptop? The other reason for mindfulness is the content is activating. I've been to so many multicultural trainings where for 3 hours, I hear someone speak to me about some horrific historical things, and it hits my heart, and mindfulness is not built in. And when I say mindfulness, it's the ability to be able to process and be present with the information being provided to you. Many times people are on webinars and they're on their phone, cooking lunch, making dinner, doing things for the kids, checking their email, and really have a split attention. And so building in mindfulness allows people to have the segue of not only physically being in a webinar, but emotionally and psychologically being in that space rather than somewhere else. And so in the spirit of the first lesson, I'm going to start with mindfulness. This is a minute and a half of a group that I think is really beautiful. It's a visual mindfulness and a mantra of a song. I invite you to close your eyes, do some deep breathing, send that last email, do whatever it is that you need to do to be present here for this next 45 minutes. Enjoy.
Please let me feel in.
Uh-oh. Sorry.
Please let me feel inner peace from my center at the center of me. Please let me feel inner peace from my center at the center of me. Please let me feel inner peace from my center at the center of me. Please let me feel inner peace from my center at the center of me. My heart is open, I am aware, in me is a knowing of love, love, love. My heart is open, I am aware, in me is a knowing of love, 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 love. Please let me feel inner.
All right. Now, if you're anything like me, you could have listened to that for the rest of this webinar, right? And the reason I specifically picked this song, and they have a plethora of amazing, beautiful music, this QR code is to their YouTube channel, is because I think of racism, prejudice, and bias as a humanitarian crisis. And when we think about that humanity, the things that make us human are at stake if we don't get this right. We have to come to this work at a place of having an open heart, of being able to find a peace, to be able to hear, to be able to act, to be able to plan, and not react, but instead to be planful. And so what I have found in the last few months of 2021 is that a lot of people have a bit of compassion fatigue in this topic. If I had given this talk maybe 6 months ago, maybe even, 10 months ago, it might have been 300 people on this webinar. But people are tired of talking about racism, of talking about, bias, of anti-racism. People want change. And we're starting to see legislation in this country that for me personally is quite heartbreaking after all of the labor, so many trainings that you all have attended, so many times you showed up, so many hard conversations you had, and people are tired of caring. And on an individual level, people are burnt out from all of these diversity, equity, and inclusion, belonging conversations at work and webinars. People are worried about COVID. Kids are going back to school. It's this Delta variant. Some people are vaccinated. Others are afraid of getting the vaccine. It's so many things complicated. Wearing the mask. It's exhausting. And in the words of my 5-year-old, she said, COVID, COVID, COVID. Aren't we sick of talking about COVID? Interpersonally, I find that in the beginning of this pandemic, people were really good at having these Zoom dates and meetings and catching up and seeing each other. But now some of these relationships have become pretty neutral, and people are starting to even question the authenticity of some of their relationships. Concerns about inequity, especially as we think about who returns to the office and where do I sit and where do I get access to, and why didn't this person have to return and I do? And then institutionally, as a consultant, I see a lot of leaders who are unclear of what to do about diversity, equity, and inclusion. They have great values, but they're like, I don't know what to do. I don't know how to do it. I don't know how to do it with equity. And so all of these things lead to just a bit of exhaustion, apathy, just an inability to care anymore. And so the lesson number 2 that I learned in this work is you have to address the elephant in the room. And so many times I came to these trainings and I already had slides and I knew what I wanted to share. And I know this topic and I know all the different types of racism and I want to point it out and I want people to hear all of these words. And sometimes I spoke really quickly to get through all the slides because I had all this information. But if we don't address that there's a huge elephant pooping on the floor, it doesn't matter if I'm over here giving a speech, everyone smells it. Something's not right here and people are not able to engage. People are afraid. We're afraid. Look at our world, our environment, our relationships. There's an increase in violence. It seems like there's new diseases popping up, and I mentioned the legislation. And so when I think about this fear, part of it is really linked to the ways that fear is used as a tool. More specifically, racism, prejudice, and bias are tools. They're tools to determine resources, who needs what, and who are we even talking about, to identify how are we getting those resources, how do we replicate those resources, and how do we control those resources. We use social categories to do those things. And the big resources right now that we are all contending with and worried about losing or having it adjusted is our time. You'll never get that back, right? Our energy, just getting out of the bed, deciding, okay, today I'm going to do these tasks. Let me try and work my to-do list. Our health, our motivation, our intelligence, thinking about things, our labor in creating, and even our relationships. One of the most powerful things that I've heard in all of these things in doing this work is one of the biggest fears in doing anti-bias work is that someone will be offended, that someone will be hurt, and that relationships will be damaged. That tells me how much we matter to each other, but it also tells me how that fear may keep us from actually having authentic, meaningful relationships with each other. And so the workplace fears, not just on a human level, but just on survival level, has to do with our money. If I say these things at work and I do this diversity training, am I going to get fired? Or are we going to lose funding if I actually write that grant to address racism? But if I just put bias or I use the diversity word, maybe I'll get the funding, right? Reputation and prestige. For me, I always think about how people might perceive me as an angry Black woman, right? And what it means for me to engage authentically. In 2021, I made the commitment to no longer code switch and to decide to express and to be my full self without needing to adjust it based on the audience, maybe the content, but not in the way that I deliver it. And that is a very fearful, anxiety-producing thing when we are all taught to perform and to be a certain way in certain spaces. It also brings up concerns about hiring, if you'll get a job and promotion, if you'll get that raise. And lastly, it goes back to that piece about conflict and really being afraid that if we are in disagreement, that it will bring so much conflict that it will not be able to be repaired. The interesting thing about conflict is it's one of the ways that we get some of the greatest change in society is when people don't agree, they actually have to sit down and talk things out. But that fear of conflict actually keeps us from being able to resolve real issues. And so when I think about this work, the things that I've raised mean that this is not a little casual walk. You can't just jump into the training like, oh, I'm gonna go to this little webinar today on the midday and then I'm gonna get back to my day. It is not a casual midday walk with a sunny day, like, oh, take a little lunch break, self-care. This thing is a feat. We are talking about dismantling systems that have been in place for centuries. We are talking about having conversations that are connected to survival at work, right? Having these kinds of dialogues with coworkers. And so it has to be approached with the gravity and the seriousness of what this work is. And so lesson 3 for me has really been about exploring trustworthiness. And trustworthiness is not just about trusting someone because they're good intentions. Like, oh, I mean, there's some great people in the world, people have good intentions, but it's really having a relationship to understanding what I'm saying to you about racism, prejudice, and bias, that you understand the gravity of this conversation. It's an authentic account of this journey that we're going in. More specifically, if you were to think about climbing that mountain, right, and you're going with these people on the top of this mountain, you wouldn't just go all casually like these folks here. Like, you're not going on a hike on the top of a mountain dressed like this. You don't have any supplies, y'all. Hey, son. No. If you think about strategic, sustainable action, number one, you're going in with a partner. They got hats on, they got gloves, book bags. You know, they're going to be marking stuff on a map exactly where we need. We got a first aid kit. Where's the compass? I don't know how to use a compass, but I believe people need compasses to climb big mountains, right? And it's going to have a whole strategy. You're going to bring in some experts. I'm going to bring in someone who knows how to use a compass. I'm not just going on a hike with other folks who don't have those wilderness skills. I got the first aid kit. I got you. That's the skill I'm bringing. Somebody else is going to know how to read a map. Somebody else is going to know how to climb and have firm footing. You know, I got a bum knee from when I ran track. So you're going to bring different skills to the table, and everyone's going to have a contribution. Now, is the gravity of that contribution and the weight and the seriousness of that individual contribution the same? Absolutely not. I would imagine the person who had the compass and the map would be a really valuable person, and maybe even more valuable if everyone is healthy and functioning well than the person who might be the nurse there, because there's no health issue there. But we all have a contribution and we have a role. And so CBRT has really, it really boils down to these core components as we think about that strategic, sustainable action. It's the awareness, and that's not different. You know, you all have been to cultural competency, multicultural trainings enough times to know that you have to be aware of racism, prejudice, and bias. My model frames it as a socially transmitted disease that we are all infected with, right? And I delineate between being infected with racism, prejudice, and bias and being racist in the sense of someone that I define as racist is someone who's not even trying. They're not out here trying to be aware. They're just like, I'm racist and I'm proud, right? But instead, most of us are like, we got some bias, right? We've been exposed to things in our life. We've been raised a certain way. Media has formed our brains in certain ways. And so we got to figure that thing out. So it's the awareness of that. And it's the awareness of how it shows up for me as an individual, what activates my bias, and then how do I cope? You know, do I get really defensive if someone said, you know, what you just said was ableist, what I'm absolutely not? Or do I say, okay, let me engage. How do I cope? The next is the investigation of that individual, interpersonal, and institutional manifestation. Can you point it out when it shows up? Like, oh, hey, there's some racism. Oh, there's some xenophobia. Oh, I know what it looks like. And then lastly, all of these things come together to reduce bias, prejudice, and racism. And when we think about reducing bias, prejudice, and racism and having that awareness and having that investigation, it has to occur on every single level. We have to have an intervention on an individual level, so it occurs within me. And I have to be willing to look in the mirror and really like pull my eyelid down and be like, what is in my eye? And like really get in there, right? Interpersonally, it might be some tender conversations with someone. I have to move my jaw. And then next is institutionally. It has to be this very building that houses my mirror that this conversation is taking place in. It occurs within the institutions and the systems of power. Now, if we do this work and we only focus on the individual level, and I would dare say in my early days, a lot of my work was more heavy on the individual level, and it focused a lot on the implicit bias. You know, I had everyone take implicit bias tests and identify like, oh my goodness, I was biased and I didn't know. But when you do that, it doesn't recognize the role of relationships and systems. It's very similar to some of the environmental work. So the idea, if I, use a metal straw instead of one of those ones that throw away, then the ozone layer will survive, right? And the planet will live because I'm not throwing away a straw. It doesn't acknowledge that there are major corporations that are creating waste, more waste than 20 of me could create in a lifetime, right? And so you have to think about that larger picture. And it doesn't negate my responsibility, but it is bigger than me. Like, I can't save the planet by using the metal straw. I wish I could, I can't. And it really focuses on internal growth without action. So I sit on my couch and I read all these books and I'm like, yep, I got that. I understand that. And it's really isolating because then I just think these thoughts alone on my couch and I watch these movies and I'm like really woke, right? Alone, doing nothing. If you focus this work on the interpersonal only, it focuses on what happens between groups and between dyads. But that often leads to positioning people who have been marginalized, minoritized as the educators and the saviors. It's usually some woman of color or some other person with a minority identity status who is the educator. And it leaves people who are in different demographics, different social identities to say things like, teach me. I'm here to learn. I'm going to be quiet and listen, right? And so then what is that? If I'm the teacher, what am I learning from the person who's just receiving the information? And this interpersonal focus often leads to specific types of bias. So we're focusing specifically on racism, on xenophobia, on fat phobia, on ableism, on LGBTQIA issues. But it doesn't really think about the bigger picture of structures. And so it leaves people that are not included in the list that I just named saying things like, well, what about me? What about this type of bias? What about this experience that I had, right? And so someone is always left out if we zoom in on certain types of biases, certain types of prejudice, and even certain types of racism within certain groups. If the institution is the focus and the organization says, you know what, we're going to dismantle, we're going to hire, these are a list of all the things that we're going to do as an institution. It focuses primarily on the outcomes of bias, prejudice, and racism, which is great. So more people are hired, the organization is more equitable in their salaries, and people are, being paid and giving the compensation that they need. But what it allows for is the individual and the interpersonal doesn't have to look within. It's not me, it's the system. We need to dismantle institutional racism. Let's get together and dismantle that because I'm not racist. Well, then who is? Somebody, what about all these individuals, right? It also reduces the individual accountability, which disempowers the individual. So often people come to my trainings and they're like, well, we're not really racist. Just tell us what we need to do to dismantle institutional racism. Well, you got to work on you. And I'm pretty sure that you've said some microaggressions to somebody somewhere, and there is some issues within you that need to be resolved. There are some interpersonal things that have happened, some ruptures, we all do it, that need to be repaired. And so if it's only on the institutional level, then there's no accountability. And the relationships in the heart of the matter, the individual heart, mind doesn't change. Often I find that too, an institutional focus, the agenda is driven by the goals of those who have the most power, which is usually the board, and look the least like the people who work the day-to-day life, right? And so they don't know a lot about what your experiences are as boots on the ground. And so they create these agendas and say, these are the things that we need to work on. But actually, there's not a lot of relationship to the people doing the work. And so it requires us to look at each of these levels. On an individual level, the task is to reduce your bias, prejudice, and racism by learning anti-bias skills. Interpersonally or relationally, the goal here is to reduce bias, prejudice, and racism by implementing what you learned, right? So it's actually using those skills. Institutionally, structurally, systemically, it's about reducing bias, prejudice, and racism by accountability for anti-racist policies, anti-bias policies, practices, and systems. So the intervention happening at every single level is critical. And even though I have this slide hierarchical because my PowerPoint skills are basic, I would say it's more of a circular relationship, right? I don't know how to make it circular, but you get the idea. And so when I think about CBRT, the next lesson is about crossing this fear and resource boundary. And so it's great that you know awareness and you understand this socially transmitted disease. Wonderful. That's a great starting point. And you're really aware that when someone brings up an issue, that this is how you typically respond. For example, I recently have done a lot of work in becoming more comfortable with the word disability. I was just raised in an era that special needs or special education services, a person who is differently abled, cringe, was the language that I used, right? And so I remember maybe about 6 months ago, someone called me in to not a call out, like I think of a call in as a really generous, gracious way to teach me rather than like, fillet me and like scream out and like heckle me. They called me in and said, you should really think about your language when you think about disabilities. And I could have become really defensive and said, well, back in my day, it was special needs, right? But instead I sat and I thought about it and I said, you know what? I don't even know enough to be defensive. I need to read some books. I need to dig deeper. I need to reflect, and I need to stand in the mirror and say the word disability over and over again until I get comfortable that I don't need to say differently abled, right? And so it's wonderful if I just stop there. But the investigation is about how it shows up. How does it manifest? Also wonderful to know what it looks like in the world, to know that when I say someone has special needs, it implies that their needs are special when we all have needs. Like, what is a special need? What does that even mean? There are the needs, like that's the need that someone has. And so recognizing, even labeling it as special is one, condescending, and it is not inclusive. So it's that piece. But until I stop being worried about fears, until you stop being worried about the adjustment of your human resources, of the adjustment of losing your job, the adjustment of not having enough energy and compassion to engage in this work, the fear that you won't be heard and understood, that this will be another training that, marginalizes and engages in the trauma Olympics, until that piece, that fear and resource concerns are not driving this work, we will not be able to reduce bias, prejudice, and racism. And so reduction requires authenticity, being value-driven, being mindful, your mind not being so full, but being present, and having strategic, sustainable action. And so without these critical components, there is work that will happen, but there's certain outcomes that will come with that. So if it's value-driven work, which is the critical component, without those values being clear, why you're doing this work, why you're showing up, the work will be emotion-driven. You'll see a recording of someone who's been murdered. How many videos have we seen in the last year? I can't even count. I remember recently someone did like a montage of sorts of people who had died. And I was like, oh yeah, I forgot about him. Oh yeah, I forgot about her. I was like, oh yeah, that was a huge thing, right? And the reaction that people had to each one, depending on if it was a mother, if it was a young boy, what was the scenario? Oh, this one was a kid, right? And so people get really emotion driven and that hooks them into the work. If the work is driven by your emotions, you will focus on your intention, and it will not be about outcome. It won't be about impact, because you actually don't know what you're trying to impact, right? You just want to feel better. You want to feel not bad. You want to feel like maybe I'm a good person and I did something. Without authenticity, the work is untrustworthy and it becomes performative. And it's really beautifully worded emails. It's nice websites that have, diversity there that, are really great. But what really happens from that? Without mindfulness, you're going to be prone to being gaslit, meaning you won't understand what's going on. You're like, wait, am I tripping? Am I being too sensitive? Maybe I'm not. Maybe I am. You won't have clarity. You'll engage in what I call the trauma Olympics. What about me? My life matters too. What about this group? What about that one? You talk so much about racism. How come you don't talk about this, right? And so you get caught into that loop. There's a defensiveness that comes because you're trying to defend what? Probably your emotions and the fact that there's some performative gesture in there. So you're defending that point. And then you'll engage in coping strategies, all kinds of coping strategies where, you give some money and then you feel better. You call your one Black friend or you call your one gay friend and you're like, oh, what do you think about this? You ask your Indigenous friend, oh, is this worded correctly, right? And so these are all ways to cope rather than really engage this humanitarian crisis, which is a feat and is heartbreaking. And without strategic, sustainable action, you cannot stand this work. You will have compassion fatigue. You know, I often say it's not about burnout. You will be crispy, right? It will be nothing there, dried up, dehydrated. This work is not sustainable. And your efforts in this will end with the grant ends. You'll look at your little resume, you'll look at your CV, and you can track exactly when you stop doing presentations and stop attending, and when you stop getting those continuing education credits, exactly at the point where the money ran out, because the work is driven by emotions and not values. And so, you know, the big piece for me in this journey is that this work is collective. Change is collective. When I started on this as a psychologist that is trained in more of a interpersonal style acceptance and commitment therapy, a lot of the work that I do as a pediatric psychologist is family work, right? But I look at the family as a unit. But as I advanced in my career, I realized that I couldn't just look at a family. I had to look at their neighbors. I had to think about the school. I had to think about, you know, what organizations they're a part of. Do they go to the YMCA? Is there a tutor? Is there an auntie? Is there a cousin? Is there a neighbor? You know, all of these things. And so looking at the family as a unit, but all the people that have contact with the family is the critical piece to being able to change and improve a child's life. That's not true for just children. It's true for us too. And when we do analyses of how change actually happens, it's not just on the individual level of reading that great book and learning the skills, it's the implementation and the accountability. And so change often begins with how and when we interact with others. And it's usually inspired by emotion, but it's not sustained by emotion. There has to be skills. You know, usually social change, if you look historically in our country, it actually starts from the bottom. And what I've seen in a lot of the anti-bias work, the anti-racist groups that I run, is that sometimes the people in those groups are really seeking an answer, and they really want institutions to do the work. And that's not to say that institutional change is not crucial, but institutions are created and formed and consist of people. We are institutions, right? Each of us create our own little microcosms of institutions. And so that same mindset of recognizing that you have power is crucial to be able to lead to that big institutional change. And that's not to say that sometimes change doesn't start from the top when a new leader comes in and they have this wonderful vision. Like, how many of us have been at a job and then new leadership comes in and they tell you all the stuff and it's about to change, right? I don't know, I'm dating myself. I just feel like I've seen that a billion times now in my career. And sometimes change happens and they do their little initiatives, but for the most part, the change is not huge and significant. The change that really impacts us is often the day-to-day. It's when I go to work and my coworker sees me. It's when something on the news horrific happened and they mention it and they don't pretend. And they don't pretend that they don't know what happened, that everyone in the world isn't talking about this thing, but when we get to work, we're just gonna pretend, right? Change happens when we are present and connected with each other. But this does not mean that we're all gonna be on the same page. You know, it means that we're gonna have to listen to the opinions of others that sometimes might be out and out appalling. And you might be disgusted and like, how could someone ever? I remember at the last election, not the January one, but the one before that of the president. And I remember this moment where someone had said, yay, this president won. And I was so confused. I didn't understand how this person with their socioeconomic status, their ethnic background, their immigration status could support this president. And I was so angry and I was so like, I never want to talk to this person again. Like, this person's an idiot, right? And I got to this space that in my head, I would never call somebody that to their face. Maybe my husband, no, I wouldn't. But I would never call someone that to their face. But in my head, I had an entire story that I was giving these stupid people that support this thing. Like, oh, they must be idiots. Psychoanalysis, oh, you know, something's wrong with them in this way. And I had all of this dialogue within me. But I realized if I was walking around with this story in my head about them, when I interacted with them, people are not stupid. They know when you don't respect them. They know when you don't like them. And how much would they be willing to hear, to listen, to understand me if I wasn't willing to hear, listen, and understand where they were coming from? That does not mean that I agree. but it does mean that regardless of the way that someone thinks, that is never going to keep me from being able to have a point of human connection. Now, what you do, that's a different thing, right? But what someone thinks, and many of us have a lot of different thoughts about a lot of different things, but we do a lot of the same stuff, that our actions are actually really similar. And so it's about listening to another person's perspective, even if you don't agree. It's about persistently fighting for what you believe in, even when it's not easy, and even when it's not comfortable. And so to this lesson, thinking about change being collective, it really is about recognizing that we're going to have to come together on this issue of racism, prejudice, and bias, just like we have in any other humanitarian crisis. And so I'm going to open it up for Q&A in a bit, but I want to end with this video, formal work, because I like to begin with mindfulness and I like to end with mindfulness. And this video, really to me, the lyrics resonate with a lot of the lessons that I've learned in this work. And this is by DEIB. I don't own the rights to any of this music. The QR code, find it on YouTube, or buy her CD, or buy the CD for a beautiful chorus that I shared earlier. Support these wonderful artists that help us get our hearts in the place that it should be. And with that, enjoy.
Billions live their lives that Muhammad, Krishna, or the Buddha are the way. Still some believe it's right to say in the name of Jesus when you pray. We are a humankind of 7 billion. So many different races and religions, and it all comes down to one. Some say God's a him, and still many believe that he is a her. Does God live in our hearts, or is she somewhere out there in the universe? We are a humankind of 7 billion. So many different races and religions, and it all comes down to one. How far will we have to go before we learn the lesson? Gandhi was a Hindu, Martin Luther King a Christian. Regardless of religion, they knew love was the mission. And it all comes down to one. Is there no God at all? Or a pantheon of gods up in the sky? We can heal our broken heart if we give up the desire to be right. We are a humankind of 7 billion. So many different races and religions, and we all want the same thing: health, love, prosperity, and peace. Tolerance is the seed, and the gift of your acceptance is the tree. We are a humankind of 7 billion. So many different races and religions, and it all comes down to one.
Thank you all. We're going to open it up for questions. If we were in person, you might applaud me or boo me or give me some other feedback. And so a QR code, this final one, is to a really short survey to get feedback, because these lessons learned are not my own. They're the things that people teach me, give me feedback in, and give me the opportunity to grow. And so if you found anything that was helpful here or things you thought you could do a little differently, please be so generous to give me feedback. I would greatly appreciate it. Thank you so much. I'm going to stop sharing and then we'll do some questions.
Wow. I'm seeing, yeah, there's applause going on, and thank you, and thank you. And I'm saying thank you as well. I could listen to you forever. Seriously. You're just so phenomenal. You deliver such powerful messages in such a calm, relaxing fashion. I just love it. But we do have some questions. And I will start asking those. And in the meantime, anyone else who would have additional questions, please feel free to just post them. But what the first question is, can we get a case study regarding your program? And they go on to say there were very interesting concepts that you have.
Yeah, thank you. You know, it's hard to give a specific case study because the work is really flexible. CBRT is a framework to be able to engage in anti-bias work. And so sometimes it looks like me doing an hour presentation as a grand rounds, as a speaker, with some maybe some questions at the end for 10 minutes, similar to this. Sometimes it looks like a 10-minute presentation to the UN, and that's all you get, and they prefer you to have 7 minutes, right? Sometimes it looks like organizations, legislation, committing to doing this work for hours. So there's one organization we work with, and we meet for about 6 hours every quarter for 2 years. And then I have groups. The more common one is that people commit to 2 foundational trainings when I introduce these concepts, as well as some other things within the model, and I flush out some of the content that I alluded to today and get a little bit deeper into that in those foundational trainings. And then we follow it up with anywhere from 60-minute to 2-hour monthly workshops. And those are very, very experiential. We talk about a variety of different concepts. We use video, we do jam boards, we have conversations. We do role plays, real plays, a variety of different ways of engaging to really try to extract this socially transmitted disease, take it outside of us, as well as to stop spreading it to each other, and then to dismantle it within our institutions. So no specific case example. I will add, I also do consultations. So sometimes I work with leadership when they recognize that they have some issues within their department, their division, their organization, their government. I've presented this work from, early childhood to Congress to teachers, you name the group. If I'm invited, I show up. But I do not typically advertise this work. And that's just because I like to only be in spaces that I'm invited to save my own compassion fatigue.
Oh, that is so wonderful. I think you answered the second question, which was, what is your audience makeup? I think it would be to elaborate a little bit on your audience, because sometimes I think people think that your message is to just one group of people. And I thought it was interesting. There are Southerners that are, that are interested in your work. And yeah, if you could elaborate a little bit, that it's beyond what people call the typical audience. You know what I mean?
Yeah, it is vast. I'm always so inspired by the folks that want to do this work. This work was developed in the cornfields of Ohio when I was going to Miami University, but I did this work in New Orleans. I went to Howard for undergrad, so I've done this work at Howard with my colleagues in my alma mater. I lived in Philly, did this work in Texas, and virtually, which has been really cool. I've been able to do this work in California, of course, the West Coast. I haven't done this work so much internationally. So if somebody knows somebody internationally, hook us up. That I think is the next level. Some in Canada, but it's mostly been in this region of the world. every audience you can think of, from young people. The youngest audience that I've had is 13, to doing it with older populations. My nursing specialty actually was geriatrics, not pediatrics. So I've worked at every end of the spectrum.
Well, I can tell you that there's still the comments are still coming in about wonderful presentation. Thank you, can we share, and all of that. The way you open it up, Dr. Crawford, which in my opinion was just totally phenomenal. How, back a year ago, people were like in the height of what had just taken place May 25th. And the emotions were all over the place. And the comments, there were so many people reaching out to me who knew me and they wanted to make sure I was okay. And there was so much energy around that. And I was so glad that you opened that up. And, I also am glad that you touched on the fact that over time you began to see things, comments, emotions, and that sort of thing kind of wane. And people who are not in the BIPOC space, this is my opinion, and I would love to hear your response to this. People who are not in the BIPOC space, many of them feel that, okay, enough is enough. I actually had someone to say that to me, like, I think early spring, like, okay, we've talked about it. When is this going to be over with? And, how do you respond to that? How do you?
Yeah, I mean, I think if it was a friend, I might say, well, run me my reparations and then we can stop talking about it. But I think in a more professional context, run me my coins. I, as a psychologist, I'm always interested in exploring why is there resistance? When people say enough is enough, do we have to keep talking about this? Usually it's from the privilege of not having to talk about it. It's not a have to. And so what is it about this conversation that is so exhausting for you? How can you build your endurance for this work that has been, this issue that has been a human issue since the beginning of time, So that is always my question. It's interesting because I think, the implied undertone of that question is that it might be a conversation between a white person and a person of color, specifically maybe a Black person. But I've also found some of my brothers, sisters, and non-binary siblings of color, some Black, but other BIPOC groups, also feel exhausted with the conversation. And that being more so that people aren't going to change. What does change look like? People are not changing. It's just lip service. And to that audience, I say, what change are you looking for? Create yourself a little checklist. If you find yourself entering certain spaces and you're like, this space is not a space where change is going to happen. This is a space that it's the same old thing. I'm always the first one to unmute myself. My white colleagues aren't speaking. Create yourself a little checklist. Like, what are the things that you need to see? And that's the piece that is trustworthiness. When I think about trustworthiness, it's two components. So you've heard me talk a little bit about this, a lot bit about it. It's one camp who is marginalized, minoritized, that is over here saying, I don't know if I could trust this group with power. And then you have this group with power that is saying, well, trust me, I'm a good person. I'm well-intentioned, so you should trust me. And it's interesting because this group over here, especially in the patient healthcare realm, is often asking me, Dr. Crawford, how do we get the trust of these patients? How do we get our patients to trust us with COVID, with cancer, with maternal mortality? How do we get Black women to trust their OBGYN? And I say, you have absolutely no right on this earth to ask anyone who has been traumatized, hurt, minoritized for trust. Your question for you should be, what do I need to do to be worthy of their trust? How do I demonstrate trust? How do I show that I am trustworthy? And also helping to educate that group that has been marginalized and minoritized to have a checklist to know when they can trust you and when you are trustworthy. So I invite my patients to look, okay, if you go to a provider that has a different, power level from you. So maybe you are part of the LGBTQIA+ community and you're going to a straight provider, right? What is the checklist that you need to see? Oh, they asked you your pronouns. They didn't ask you. You might not trust that person. They didn't assume that you were partnered. Oh, Okay, that's a trust. I could trust you then. You didn't make that assumption. You said he, her, they. All right, you had your pronouns already. Okay, check. You get a check mark. Black person. Oh, they didn't assume that because I came here with my kids by myself, that my kids didn't have a present father, right? So if you made that assumption, you don't get trust. So create your own trustworthy checklist rather than, I don't know if I should trust, or how can I get trust? And usually the relationship for trustworthiness is not that complex, but I really think it needs to be. And these are the questions we should be asking, not asking about trust, but instead trustworthiness.
Oh my God. Oh my God. This woman is amazing. And you're going internationally. I can see it. I know it. I feel it. So listen, thank you so very much for this very amazing, amazing part one. And I feel honored and I'm so pleased that I can say part one, because we have 2 more parts coming. And I'm so excited about that. And for those of you who are on, please, we look forward to seeing you. I think it's October 14th. Is the next one. We look forward to seeing you at part 2. Please come with an open heart and with your questions. We want to say thank you for joining us today. You could have spent your hour anyplace else, but you chose to spend it with us. And for that, we're forever grateful. Have a wonderful day. And thank you for spending time with us.